about something that's pretty important, especially to the medical world. And today we're going to be talking about migraines. And there's been a lot of research going around migraines recently, and a lot of people in the world suffer from migraines. And migraines can be on a whole lot of different levels, and they can be really deadly, and sometimes they can be really minor. So today I'm going to be asking questions to Dr. Anit Behera. So he's going to be answering some of our questions about migraines. So why don't you introduce yourself?
Okay. Thank you for having me here. My name is Anit Behera. I'm a neurology resident, and I deal with a lot of patients with migraine headaches, especially in my clinic. And so I'm happy to answer any questions you have for your web show.
So the first thing is, what exactly is a migraine?
So a migraine is a form of headache that is inflammatory in nature, where there is a problem with the blood vessels of the brain, where they have, we call it vasoconstriction, where it becomes very, very tiny and it decreases the blood flow into the brain. Because of that, it causes headaches, and therefore it can cause very debilitating side effects from that, including really one-sided headaches, having issues with light sensitivity, having issues with hearing, and even sometimes having a premonition or an aura before those headaches.
How do these migraines vary on different scales?
So they can vary to having them very severe to the point where they can be, if you ask certain patients, they will say 10 out of 10 headaches, to the point where they can even have some neurological deficits, like feeling weak on one side, having numbness or tingling, having ear issues like hearing, or something called tinnitus, which is a ringing sensation in the ear. And sometimes it's so debilitating that they may have to come to the emergency room to get even treatment at times. That's
very intense then.
Yeah.
So are there any symptoms of migraines, or is it usually a sudden kind of thing?
So typically there are some characteristics that can lead to migraines, but most migraines actually can happen suddenly. They can occur on a monthly type basis, but if there is a sign prior to the migraine, we call those auras. And an aura is basically a sign that a migraine is basically coming up. You can call different types of auras like a visual sensation, like any floaters, or you're hearing something weird, or you're tasting something weird, or you're smelling something weird. So these are all different types of auras that you can get prior to a migraine. About 15% of patients, 15 to 20% of patients with migraines have migraines with auras. And so, but the remainder really don't, and so they can happen suddenly and can be quite debilitating.
What are some things that trigger a migraine?
So some of the things that trigger a migraine include certain wines or cheeses, certain even triggers specific to patients. It could be dust, it could be a certain sound even at times, but anything that causes, you could say, changes to the blood vessels of the brain that can trigger a migraine. But we try to tell patients that to stay away from the wines and cheeses and chocolates, because that can certainly trigger migraines.
Now, what should we be doing in order to prevent migraines, and what should we be doing to make sure that they don't happen? Are there any medical things that we should be doing?
Sure. Whenever I talk to my patients with who come in with migraine headaches, I usually try to explain to them a three-prong approach. The first prong is preventative situations or preventative things you could do that are non-medicative. The second one is something that you can start a medication to take daily for preventing the number of migraine headaches. And then a third is a medication that you can use to break a sudden onset migraine headache. And so I can go deeper into each of those three prongs if you'd like me to. I can go forward with, yeah. So the non-medicative approaches that I usually like to tell my patients are including, you can wear certain rose-tinted glasses, or you can wear earplugs to prevent videos and sounds. You can also do some aromatherapy as well. Peppermint, lavender oils are excellent for migraineurs as well. Obviously, decreasing the amount of stress and also getting enough sleep, exercise. These are all important things to do for preventing migraine headaches. Preventative medications, there are multiple. You'll see them on the commercials about different types of medications, and that's primarily because of the fact that there are new therapies out there, especially the ones that target the CGRP receptors itself. We call them the anti-CGRP medications. Those are shown to show some good benefit for migraine headaches. I like to start with the more traditional ones, certain water pills, such as topiramate is one that I really like, or you can use a medication in conjunction with other conditions like depression, so you can use a medication like amitriptyline. But there are a lot of good research out there. I'm sure you've heard of Nurtec and other like Emgality, and so those are all good medications that are coming into the market, and they're definitely getting some good notoriety. And then obviously whenever you do have a very big migraine headache, it's important to try to break them. And the standard not the standard, but the mainstay of medication that we use is called sumatriptan. Or Sumatrex. It's actually a good medication to break headaches, and so I like that medication to break the headache. But there is a effect from that where you should not be taking that medication every day, number one, or number two, where you should not be taking it more frequently in a day. And so that's a breakthrough medication. But other things that I like to use include naproxen with Benadryl. Excedrin migraine is another good medicine that I like to break headaches. So these are all the different therapy approaches that I like to use for migraine headaches.
So I actually do have migraines, and they have gone to a very severe point where I've had to go to the ER. And when you mentioned topiramate, I remembered that a year ago I actually used to take that medication. Fortunately, now it's not as bad. So one final question I have is, what would you say to people that have migraines?
So I think I would say that the most important thing about migraine headaches is that it is definitely very treatable. It's something that should not be disabling, and if you have a very good neurologist, they can take very good care of you in terms of your migraine headaches. Like I mentioned, there are different ways to approach from non-medicative therapies to medicative therapies, and there are a plethora of research that is out there that's currently being studied for migraine headaches. And so while it is very disabling, and I personally don't have migraine headaches, but I feel obviously having migraine headaches can be quite disabling, just know that there are doctors out there that treat them, and they are always looking forward in taking care of you, and it's certainly something that you can manage and live with the rest of your life and do very well with.
So there you have it, guys, and for those of you that have migraines like me, maybe we could try taking some of this advice. I'm sure that would be very helpful. Thank you guys for being with me today. We'll see you next time. Bye!